Well, I didn't prepare slides for this panel. I'm sorry. But a lot has been said, so I don't have to say a lot. I'm just going to echo Colleen's comments with respect to the exposure data availability. Um, it's certainly, the field has certainly grown a lot, and there's a lot of data out there. There's a lot of different models. And as Colleen pointed out, none of the exposure metrics are perfect. So I am a big fan of, I mean, I actually started my career doing data fusion, but in this situation, I'm actually kind of a big fan of having the data available to all scientists so that we can reproduce results with different data sets using the same and exposure metrics, and then compare effects with different exposure metrics. It's a little bit, it's hard to do. I think there has to be like a really significant foresight into organizing a platform for that kind of sharing, and each model has a lot of specifications that would have to be considered, but there are some very good efforts. I know at EPA we start doing Science Hub and putting our data, making it more easily available, which, you know, before we were just doing it with emails, and that was not, the data tends to be very big. So, but with respect to exposure, I also I see a huge growth opportunity with the amount of new data that are coming online, and that is, one is remote sensing, and the other one is personal wearable technologies and personal sensors. So remote sensing, the new satellites now can collect data at 30-centimeter resolution. So if anyone is smoking a cigar in the backyard, we can find you. I mean, not me, but they're commercial satellites, you know. So, but the data can be utilized, and it's really a very, very rich source of information. And with respect to sensors, sensors bring a lot of good opportunities, but we've focused a lot at EPA in comparing the performance of different sensors, which sensors can be recommended to users, and which can, and I cannot really speak on the results of that, but really none of those sensors are really meant for wildfire episodes when you have 1,500 micrograms per cubic meter for extended periods of time. Again, platform at which we could upload and compare different data sources, different sensor data. A lot of the sensor data are publicly available, but a lot are still proprietary. So, you know, any kind of obstacles, any kind of barriers that we can remove toward that front, I think would be very, very worth cause. And then now, with respect to sensor data and health, a lot of what we know about epidemiology is based on the type of monitoring that we used to do, and that's 24-hour averaging. And the new questions are arising. They're different because wildfires are now present, and in California in particular, new policies are being recommended for actually making actions and making, we heard this morning about employers having to be ready to help their workforce. That in itself is going to start asking a lot of questions, like at what point do we have to do it, and at what point is it just voluntarily? So those kind of questions then start asking the questions that we don't usually address in epidemiology, or maybe I'm short-sighted, but like what does sub-daily, sub-hourly exposures mean, and when do we make those cutoff points where like you have to act to protect someone's health? And what else can I? It would be great to if sensor data was available publicly, that we could also incorporate a lot of the health information that we have now with how well are they, they may not be measuring air pollution perfectly, but they may be pretty good indicators of when you start feeling uncomfortable and you actually change your behavior. Another question that I think a lot of communities are struggling. We talked a lot about mental health today. That's a very recent conversation, actually. A few years ago, that wasn't even mentioned in the literature, but now it's mentioned almost in every meeting. But a new type of exposures is these exposures when the summers are taken away from the communities, when the communities have 6 weeks or up in Canada for like 2-3 months of such heavy smoke where people cannot see across the road. So what are the conversations we should be having there, and what are the solutions for that? That's tough. With that now, I'm gonna go to my last point is toward solutions. Is we know that one of the mitigating measures for preventing wildfires of these large proportions is introducing more fires on the landscape. And that while there's good and bad fires, their smoke is not good for anyone. And so can we be, as a community, ready to help guide the conversation? Like, can we do ecological benefit and yet protect our health, and having those conversations out in the open? I think that conversation has really moved in last few years. Federal agencies work very closely together and communicate a lot on that topic. So, but there's no yet any kind of solutions really in the long run. So I think that's all I have to say.